Could you give us an example of a patient to illustrate the kind of work that you do?
Some feedback from one of my patients that just sticks in my mind. He said, "My skin is absolutely fantastic. It's been the best it's been for 20 years. I can go out now and wear a pair of shorts without feeling self-conscious. It's absolutely great. I can go out and play with my grandchildren. I can go out in the sun. I can go in the swimming pool. And it's just fantastic. I'm in the best place with my skin that I've been for a long time."
That's fantastic, Claire. How lovely. What was he on?
He's on methotrexate, but when I took over his monitoring, we really worked over a few appointments in optimizing his topical treatment. So that's something that I've been doing with my patients when they've come to me.
That's a very nice story. Now, could you talk to us a little bit more about topical treatments for psoriasis?
Our tools in the toolkit for the psoriasis patients are emollients, very important. And then we've also got the maintenance sort of treatments such as Enstellar and Dovabet, and also some Silkis ointment as well, which is the vitamin D part of the Enstellar and the Dovabet. So it's very much a case of using these medications when we need to use them. So we need to, obviously the Enstellar and the Dovabet can be used for flares and then can be used as and when they're needed. So it's a case of get the patient getting into a regime.
And what about moisturizers?
Moisturizing, very, very important. So keep moisturizing, but then I may advise patients, if they're struggling to put the moisturizer on when getting washed. That's, when you get in your shower or your bath, when you get out, get yourself dried, skin's still a little bit damp, put your moisturizer on, wait a couple of minutes, a few minutes for it to soak in, then get dry. That's the least impact on your day-to-day, is to at least get a moisturizer on. We can supply those moisturizers from pharmacy. Those moisturizers can also be purchased because there's more moisturizers coming through that's a once daily preparation. So that's absolutely ideal to, put that on at the point of getting washed when you're already doing all that, with your skin anyway. And then the treatment creams, so the likes of Enstellar and Dovabet, they're once daily preparations anyway. So we can, just incorporate that into how we're doing things.
How do you approach explaining to dermatology patients, especially psoriasis patients who may have half a dozen or so different treatments? How do you approach talking to them about their treatment?
It's like tools. The other consultant, tools in the toolbox. So I like that. You've got all your tools in the toolbox. You've got your tablets. They take the most strain of treating the skin condition, and then you've got all your other tools in the toolbox where we've got to say, well, use some of that or use some of that. That doesn't quite work, then we just maybe switch it around a little bit. And going back to what I was saying before, knowing when to use these medicines, because there's no use giving somebody a big tub of greasy ointment and say, here, put that on 4 times a day, and they go off out to work and they're sitting in a meeting or whatever. Well, that's just not going to happen. So we need to work with the patient, with their lifestyle, and come up with something that they're actually going to do and that's suitable for them.
That's an interesting approach. And what about helping people to manage their condition themselves?
It's also educating patients to know that they are allowed to put those medications with that steroid in on their skin every day for 2 or 4 weeks to get a flare under control. It's upskilling and educating the patient to know that they can manage their own skin condition by doing that in between appointments. They don't need to wait to get an appointment with somebody. They have, we're upskilling the patient, the expert patients. They know they can use those creams, topical medications to treat any flares, get on top of it before it gets bad, and then step back down from that and continuing with their moisturising. So it's a very much, two-way thing. of patients being educated to know what to do and having the tools to do it with.